Hi, I'm Rob Stevens. This podcast is about arterial blood gas acid-base analysis. Don't worry if you don't know the answer. The podcast is also meant to help teach you about blood gases. Why don't you click on the next slide now? Why don't you read this scenario and then have a think about what the pathologies might be in this patient. Then on the next slide, you'll see the choices of single best answer. I would pause the podcast at that point and have a think about which is the most sensible answer. Okay, so you've had a little chance to look at these options. So the situation is that we are asking about acute hyperventilation. As I might have said before, acute disorders of the respiratory system, there is not enough time for the metabolic system to compensate. The compensation for a respiratory disorder, which would be a metabolic compensation, takes at least 8 to 12 hours. And in an exam essay, we'd say compensated or partially compensated. But we're talking here about an acute, non-compensated, therefore, disorder of the respiratory system. Okay, let's have a look at this. So with hyperventilation, increased ventilation, we increase the elimination of carbon dioxide, don't we? Because we get rid of CO2 with our breath. So if we do that more, we get rid of more CO2. So we expect this patient to have a low CO2. Secondly, that low CO2 would be expected to raise the pH, to make the blood H+ tending to alkaline, because it would remove carbon dioxide. So there's less carbon dioxide to bind with water to make carbonic acid, which then partly dissociates to H+. So there's less H+. I've also said that the patient will not have any metabolic compensation, so therefore the bicarbonate will be normal. So that's really all looking like number C, isn't it? Normal bicarbonate because there's no metabolic compensation. The CO2 will be low because we're breathing too much and we're getting rid of more CO2 therefore, so there's less in the blood. And the pH would have gone up because there's less H+ in the blood because we're getting rid of CO2. And CO2 combined with water goes to carbonic acid, and that dissociates partly to bicarbonate and H+. And if we're getting rid of CO2, we're pushing that equation away from H+. So this answer is number C.